Communication Basics for Healthcare, a guideline for healthcare professionals, presented by Ash Brar. What is communication? Communication is the interchange of information between two or more people. In other words, the exchange of ideas or thoughts. This kind of communication uses methods such as talking, listening, writing, reading. You can also use painting, dancing, and storytelling. Human behaviors have a strong influence on communication. People engage in two types of communication, intrapersonal and interpersonal. Interpersonal takes place within oneself and commonly referred to self-talk or self-dialogue. Interpersonal occurs between two or more persons, the verbal and nonverbal messages that are sent and received during interaction. There are four elements must be present for successful communication: a sender, message, receiver, and feedback. Sender, source of message. Message, verbal or nonverbal expression, thoughts or feelings transmitted from a sender to receiver. Receiver is the recipient of message. Feedback, verbal and nonverbal response of receiver gives to sender about the message. The following factors can influence the quality of communication: perceptions, experiences, physical and mental health, emotions, values, beliefs and cultural influences, gender, age, and the relationship between the sender and the receiver. Two levels of communication: verbal and nonverbal communication. Verbal communication relates to anything associated with spoken words. Understanding verbal message involves the ability to form abstract ideas and concepts. Verbal communication represents only a small part of the entire communication. Nonverbal communication are messages sent and received without the use of words. The majority of communication is nonverbal. As a result, listeners tend to rely on body language and style of verbal delivery more than words. Why nonverbal communication is important? We spend a great deal of time communicating nonverbally. As long as we are in presence of others, we never stop communicating. We can stop verbal communication, but not nonverbal communication. Types of nonverbal communication. Body orientation is how we orient ourselves in relation to others. Do we face forward or do we lean away? Generally, facing and leaning toward signals interest, while facing and leaning away signal disinterest. Gestures, like a friendly wave, a shrug of a shoulder can be an intentional way to communicate a message. Gesture may also be unconscious beyond our awareness. An example of this sort of gesture is fidgeting. It's a usually sign of discomfort, anxiety, or stress. Posture. We have many expressions in our language which link emotional states with our body posture. Facial expressions. The face is probably the most noticed part of the body, but does not make it easy to read. The number and kind of facial expressions are phenomenal, and we can change our facial expressions with great speed. There are 6 basic emotions: surprised, anger, fear, disgust, happiness, and sadness. Eye contact. The eyes can send many messages. Generally, eye contact, looking directly at other persons, is a usually sign of interest. Lack of eye contact, looking away, usually signal lack of interest or desire to avoid contact. Vocal factors. How we say words can communicate as much as the words themselves. A certain way of speaking can give the same words many meanings. Clothing. Besides providing warmth and protection, our clothing conveys many messages about distance. The way we use space can often give message about how we feel towards another person. There are 4 interpersonal distance we use in our everyday lives. Touch. Touch is a powerful communication tool. A pat on the shoulder, a firm handshake, a warm hug express far more than a lengthy speech. Effective communication is necessary to provide safe and effective care. Thank you for listening.
Created using Powtoon.